Hello, I'm Mohammad Vojdani. I've studied English language and literature and media management at university. I've helped many language learners learn and practice English language with confidence, and I'm helping professionals and experienced people to share their views, their experiences with the world using English language and social networks. In addition to the work I do, I think about a number of issues, and I'm a bit sensitive about social issues in particular. I'm interested in promoting culture, education, and human relations based on truth seeking. In addition to teaching English, students' self-esteem is also important to me. For me, language learners' learning problems and obstacles are important. I recently met a female doctor and I realized that she's the same as me. Why? Because in her field of work, in addition to doing professional work, she also thinks about other aspects of work and looks at issues from other angles. In the first meeting with her, I realized that both of us do not work only in our specialized field, but we are kind of holistic. Let me tell you the story of getting to know this doctor. A month ago, I went to a beauty clinic to treat acne and pimples on my face. There I met a beautiful doctor who worked in cosmetology. The doctor's name was Shارلوت and her last name was Tayar. While sitting in the waiting room, I could hear the voices of the doctor and one of the clients. The client who was in the doctor's room was a girl who was about 19 years old. As I listened carefully to their conversation, I realized that the girl had a cosmetic consultation with the doctor. She asked the doctor to remove fat from some areas of her body and make her hips look like a superstar. It was an interesting request. The doctor asked the girl to stand a little further away to look her over carefully. After looking her over carefully, the doctor told the girl,
"Your body is normal now, and you can work on other aspects for the time being to become like the people you love."
The girl asked,
"What other aspects do you mean?"
"I mean their acting, their singing power, their dancing, their going on stage,"
said the doctor.
"Learn their art. It is not necessary to have the same hip size as a certain superstar."
The doctor continued. It was very interesting. Accepting the girl's request brought a good benefit to the doctor. But despite this, doctor gave these explanations to the girl. The doctor went on to say to the girl,
"If I want to inject fat into your desired area now, it will definitely be profitable for me. But I should cut some areas of your body to take fat from your flanks, and this leaves some scars in some areas of your body which last forever. Then I should inject the fat into your buttock, which again will cause scars, and your naked body will be scarred anyway. Maybe you will be happy about this, but how do you know that you will shine on stage with this work? Isn't it better to shine on stage first? Isn't it better to find your own brilliance and charm first, and then think about these things?" The brilliance of the famous superstars was not just because of the beauty of the hips. This brilliance is the result of their self-confidence, and after they have become an international face by relying on their art, their bodies have also received special attention from their fans. Just as we have had people who are said to be dissatisfied with their body parts, but they haven't changed it, and after they have started the career and have become successful, that specific and unknown part of their body not only didn't look bad, but became their point of distinction. And the fans also happen to be attracted to the same different parts of them, and they see that unique feature as somewhat focused on their physical parts. We have had many of these cases, such as the lips and mouths of those actors who may not have pout lips in the old-fashioned style, and by the way, they had wide mouths and third-rate lips, which were not acceptable at the time, but later with their brilliant acting. This unacceptable physical distinction of theirs is also known as a model of beauty for new generations, and perhaps the lip injection industry has become popular since then. This type of hips was not fashionable at that time. In fact, their art and their artistic brilliance have made them able to brand and fit a certain model of appearance and physique. Now you want to become such a person with their brand? It doesn't seem very logical.
In short, during the time I was waiting at the clinic, I noticed that some clients had such requests, and the doctor first looked at what they requested and explained well what the result of this request would be. She also asked them a series of questions, including,
how do you want to look like? More beautiful? More attractive?
It was interesting to me that the doctor would first talk to the client in a reasonable and acceptable manner, not just at the request of them, although they had the right, and then she would either accept their work or advise them to think about the matter for a while, and then if they were still determined, they would start the work in a gentle way, so that if progress was made and the client was still satisfied and willing, they would continue the work. I still remember what the doctor said to that girl.
Progress is not the body's prominent or concave appearance, progress is the act and the art you present.
Dr. Tayar's professional and honorable approach made me think to have a little discussion with her and ask her the question I had about LGBT people. And how interesting that I found out that she had written a text about these 5 years ago. Doctor graciously and generously gave me her manuscript and said,
"This is my opinion about your question that I wrote 5 years ago. At that time, there was no news about all these criticisms and debates that we are witnessing these days, and everyone was going strictly according to the fashion of the day, but at the same time, my opinion was based on professional knowledge and experience and an anthropological perspective."
I read Doctor's writing, and it was very interesting to me that she raised such a discussion so beautifully a few years ago. The charm of the story was that a female doctor in Iran is doing beauty things, and at the same time, she has thought about these things and has written this content. I had some questions about this topic that had been bothering me for some time, and it was very interesting to me that the doctor prepared and wrote about these issues a few years ago. It was clear that since the beginning of these issues, she has turned her mind to reflection, research, and critical thinking in this field. Apparently, the goal of the doctor was to first know her views better and, more importantly, to be able to use the result of these views in her practice on her clients in an honorable way. I asked the doctor's permission to share the story of my acquaintance with her and the story of her writing with you, dear subscribers. She graciously agreed. Then I asked her to allow me to convey the content of her writing to others. I think it's a pity that these valuable and informative materials remain anonymous. I think people should be aware of them. You know, many experts, doctors, and experienced people sit in solitude, think, and sometimes write very useful things. Many times they share these materials in private circles with their friends and relatives, and many times they use them in dealing with clients and patients. However, it's a good idea to provide all people with these materials in order to bring more awareness and benefit in a practical way for people in the society. Once again, the doctor agreed and allowed me to publish the content of her writing here. Are you ready to see what the doctor wrote?
More real support for transsexuality. These days, the atmosphere for supporting the rainbow community is heating up again. This is an opportunity for me to try to make some points about more real support for trans people. I have chosen this rainbow spectrum, i.e. trans people, because of its greater vulnerability, and apparently the most oppressed spectrum of the rainbow is facing an identity conflict. Transgenders in special circumstances, whether physical or mental, in an unwanted, organic and genetic form, or as a reaction to educational, family, social, cultural, traditional consequences, or lack of existential capacity to accept their natural gender, eventually feel a mismatch between sex and gender. Until now, in terms of paraclinical, laboratory aids and diagnostic radiology, there are no clear scientific reasons about why these people are different from other people of the same sex. And the only reasons available are just mentioning the mental shock of the mother at about 3 to 4 months of fetal age, and the sending of the opposite sex code in the hypothalamus of the fetus, and the difference in the size of the ring finger and index finger which cannot be followed diagnostically and statistically. Among the other reasons mentioned, the strong insistence of parents in wanting the opposite sex of the fetus during pregnancy has been mentioned. Other educational, social, cultural and religious factors have also indicated that the existing gender is not acceptable for the continuation of a person's life. According to these explanations, in the diagnosis of a trans person, and in the diagnosis of the discretion and necessity of sex reassignment surgery, other than the person's own request at the time of psychological counseling, there is no other evidence confirming the diagnosis. The group organization of these people in repeating the same mental psychological symptoms and expressing their oppression of not being understood by the people around them has given the irreversible process of surgery and hormone therapy a false authenticity and beyond the expected limit of the reality of the story, and obviously, this storm, the increase of transgender claimants at the time of adolescence has taken victims. There are many people who, due to temporary membership in this forlorn group, have put their whole existence to the end of the road, and after complex and painful surgeries, they have not only not reached the desired peace, but also they have been deprived of the right to choose another alternative and return to the conditions before the surgery, and they have suffered severe mental injuries, and have reached the point of suicide. Now, the 50% increase in the demand for gender change, according to Forensic Medicine of Tehran, according to Radio Farda, and more sightings of trans people in the city, prompts people to question and think about the reason for the increase of this oppressed and vulnerable group in the wide range of gender, and where does this increase lead? With psychology courses and hearing repeated symptoms in the virtual world, which in addition to environmental reasons is somehow a special and modern movement for young people, is it possible to find those few candidates for surgery who have enough guarantee for a peaceful life after gender adjustment? To what extent is accurate and practical diagnosis of trans people and the permission of surgery justified and reliable? The occurrence of any minor mistake in the diagnosis and in the surgery can make the volunteer and his family despair for a lifetime and bring them to the point of collapse. It is our moral and human duty to be concerned about preserving, maintaining and supporting the world of creation, especially preserving the biological rights of living beings, as well as preserving the human rights of people, and respecting the rainbow gender spectrum without mocking. But in the case of trans people, it should be noted that they are not only involved in issues of sexual orientation, but they also struggle with extensive identity changes. Relying on insufficient information, ignoring serious complications and unguaranteed consequences, not paying close attention to this sweet and hard-suffering group, and dealing with them a little negligently. Facilitating the path of surgery and hormone therapy to such an extent and abundance, and only based on the repetition of parrot-like symptoms, and based on the desire of an adult, a desire that may be expressed in a limited period of time, and may be temporary, and due to mental boredom at certain stages of life, may be far from the real protection of human rights. Due to my long-term employment in the medical profession, I witnessed that among many clients who came for cosmetic procedures, a number of clients, apart from appropriate and reasonable beauty, showed signs of lost gender identity with extreme and biased requests. By taking the medical history of a large number of trans people, as well as the many diagnostic studies that I have conducted due to experiential and professional necessity, I have obtained information about 2 common types of surgery that seem incomplete and insufficient, but I will explain them briefly. MTF adaptive surgery. MTF adaptive surgery, transformation of male sexual appearance into desired identity and female sexual appearance. After this type of surgery, we have a woman who used to be a man. His penis is removed and a part of it becomes a clitoris and is placed in the middle of labia majora, which are made of the skin of the testicles. Vaginal space creation for penetration is done by removing the mucosa of the rectum or anus from the back, and it is replicated in the shape of the internal mucosa of the vagina. It is necessary to mention that this mucus is not capable of lubricant secretions like the real vagina of women, and in case of sexual penetration, it will act like anal penetration, and real female vaginal orgasm will never happen, and sexual satisfaction is only limited to rubbing the clitoris or that small remaining part of the male penis, which is known as clitoral orgasm, and this is exactly the same as sexual satisfaction in female masturbation. And apparently it can be seen as an incomplete form of male masturbation before the operation. Therefore, the peak of sexual pleasure of a trans woman will be limited to the rubbing of the constructed clitoris, along with mental imaginations and penetration into the newly designed anus or vagina, which is precisely made of anal mucus. Of course, with the administration of slightly carcinogenic female hormones until the end of life, breast growth, and the formation of female organs and female voice will take place to some extent, but due to the absence of ovaries and uterus, fertility and reproduction will be impossible. If the treatment is hormonal and non-surgical, the complexity of the treatment is less and often under the influence of hormones, fertility will also be disturbed. FTM Adaptive Surgery, Trans Men. FTM Adaptive Surgery, Trans Men. The FTM surgical procedure is based on the removal of breast tissue as well as the uterus and ovaries, and during lifelong injections of the male hormone, testosterone, the previous female clitoris area of the volunteers will be swollen and enlarged during a painful process, which of course, it will not have an erectile function. And again, having orgasm for these newly established men will only be in the form of clitoral rubbing and somehow in the form of male fantasies and female masturbation, or in case of communication with another man, their anus can be used for penetration. In this type of surgery, with the lifelong administration of male hormones, more hair will grow on the body and face, and a male voice, face and body will occur to some extent. In addition, due to the lack of sperm production, male transsexuals will have male infertility, and will not be able to impregnate their sexual partner. These people themselves are no longer fertile in any sexual relationship of any kind. In FTM gender reassignment, there is an advanced and very difficult operation called phalloplasty, in which a thigh or forearm graft is used to create a male sex organ, penis. The complication rate of this type of operation is 80 to 90%. The procedure is as follows: a flap is taken from the person's forearm, and it is shaped into the skin in such a way that the male genital organ is reconstructed for the woman who has become a man. In addition to the complexity of this type of operation, the activities of the new organ are also not similar in appearance to the congenital male genitalia. In phalloplasty operations, this organ does not grow without help and is usually available in just one size. Apparently, the power of spontaneous erection and spontaneous stimulation of this new organ is nothing more than the female clitoris. Since there is some stimulation in women themselves, during which the clitoris area swells a little, and they use this stimulation and swelling to stimulate the male sex organ. Therefore, the male genitalia is made from a very large flap that is removed from the person's forearm. For this purpose, the surgeon goes down to the muscle layers of the person's forearm and reaches the vessels and nerves, and that forearm gets an unpleasant appearance. At the cost of this unpleasant appearance, a flap is made that is not very functional because it cannot have the function of sex, and its use is something like a prosthesis that only creates a little prominence in the clothes that the person wears. It is said that some of them are controlled by a pump from below to inflate a little. Therefore, it is completely a physical movement, not a movement of the mind, not a movement of imagination, not a romantic movement, and not a movement that ends in sex from the mind. Usually, intercourse with this type of male sexual organ does not lead to complete satisfaction of any of the partners, and their sexual activity will be almost similar to the sexual activity of two lesbians with the help of a dildo, because the sexual, physical and artificial activity will be based solely on vague imaginations. Another limitation of such surgeries is that tissue death or necrosis and infection may occur during forearm transplantation. Metoidioplasty. To create a male penis for this group of volunteers, there is another type of surgery called metoidioplasty, during which trans men take testosterone, and their clitoris grows after a while and reaches about 4 to 5 centimeters. As the clitoris enlarges and moves forward, it becomes somewhat similar to a male penis. and surgeons convert it into a male penis by using surgical techniques and cutting the skin. Metoidioplasty has advantages over phalloplasty, among which being easier, less complications, lower cost and shorter duration of surgery can be mentioned. Unlike phalloplasty, the sexual movements in the metoidioplasty method are completely visible, and there is no need for a prosthesis, but still the sexual movements are not of the quality of a normal man. It is said that in this method, a person can achieve sexual satisfaction, but one of its disadvantages is that the size of the penis may not reach the size of other normal men, so there may not be enough penetration. The small size of the sexual organ disturbs the relationship with the partner. Now, according to these brief and general explanations, we will have two not-so-perfect male and female reassigned beings, with non-routine and incomplete sexual relations, incomplete orgasms, and impossible fertility, the result of which is that sometimes after complex and hard surgeries, in some cases done to achieve a little more sexual pleasure, it leads to homosexuality, and sometimes in case of lack of sexual satisfaction and lack of satisfaction with the new and different appearance from their previous ideal mental perfection, they suffer great despair, sometimes even more than the despair at the beginning of the journey, but with the difference that at this point, there is no hope for further change and improvement. Even the hope of returning to the starting point of the story has been lost. Unfortunately, the number of suicides after the adjustment and due to the previous misconception was not low. The result of MTF adaptive surgery is a girl with an almost feminine appearance due to the use of hormones, but she is barren and has incomplete sexual relations and lovers who either know about the story or are involved in the relationship out of curiosity. In such relationships, special adventures arise, and a lot of energy is spent on explaining the complexities of the relationship. Finally, these relationships often fail in love and sex. The result of the adaptive MTF surgery is a boy who will not be as free as a biological man, but almost like before the operation. He is still not completely comfortable with being naked in public places, and perhaps he still won't be loving his body enough, this time, not because of the presence of the breast, but because of the surgical lines and scars and the unusual dark spot on the nipple. Again, these boys will have severe complications in attracting a love and sexual partner, and in most cases, they will face abandonment and failure. The purpose in thinking about this matter and spending time was to deal with the conditions of these very intelligent and kind young people. Young people, the majority of whom have focused on their sexual identity only at a certain point in time for different reasons. As in human identity, all people experience pauses and thoughts. Except for intersex people who have their own physical and scientific reasons, and are definitely forced to choose a physical identity in adulthood, which has very deep roots in the change of sexual identity, and according to the almost certain prediction, adaptation will be a cure for their severe pains. The majority of people along this path, even a very limited number who really suffer from identity disorders, 1 in 30,000 people, often followed by the formations of rejected and half-repentant people, who are only slightly relieved by attracting more people, have entered this venture. This majority have entered this arena due to different reasons such as modernity, attention-seeking, desire to be special, or mental diagnostic disorders. It is better for this majority to benefit from cognitive psychotherapies. It is a pity that due to the modern and contagious social promotion, with the negligence of the medical authorities, and only relying on a limited number of sessions in a short time, this majority, in the hope of definitive treatment with reassignment, and with the intention of reaching the utopia of regaining mental peace, and achieving perfection, enter this sinking vortex with only a treatment proposal based on gender reassignment, but at the end of the story, they will see that another day, another dollar, not only did they not reach their desired peace of mind and perfection, but their identity confusion continues riding on a more limp and lonely horse than before. I wish mental psychological examinations were a little more universal than the common and cliched questions and answers of treatment centers so that this vortex of TS does not become bigger, stronger and more destructive. The hope is that the small treatable source will lead to meditation and mental health and simpler treatments before it becomes so overwhelming and destructive that it takes the power of investigation from experts. Any huge number is not necessarily a proof of acceptance. Increasing scientific reviews and awakening the professional conscience of experts, even if it is accompanied with more time and fatigue, is valuable and promising. It is true that many trans people face difficulties in accepting their gender, but many of these difficulties have been temporary, and they have found acceptance within a short or long period of time, with a little suffering and patience. Perhaps waiting and accepting is better than psychological collapse and going through difficult and complicated treatment procedures that will unfortunately be irreversible. If we help people escape from their natural gender identity and put these half-lost people in the inexperienced group just for the sake of ad hoc relief, quick treatment, and replacement of trans people in a group, it seems like kicking the can down the road. Moreover, it is a sign of sexism and human inauthenticity. Perhaps this impatient treatment method and the widening spectrum of the colorful rainbow with attractive colors not only did not bring a definitive and patient treatment and did not contribute to human liberating freedom, but relying on the hasty confirmation and stabilization of new sciences, it caused the disintegration of the pure human unity. This method has the intention of getting rid of the boundaries of men and women, but it has inevitably led the single human being, who is manifested in two halves, male and female, but with unique characteristics, to multiple and increasing categories, and the discovery of new colors in the charming spectrum of the rainbow and the increase of its alphabet letters are increasing more and more every day. Doesn't our silence or indifference towards the continuation of this process lead to the weakening of human rights, and the division of the shining sun of human beyond sex and gender, to the childish deception of the rainbow spectrum, in the loss of collective identity? Pride Parade. Pride Parade. In the final part of this article, I want to raise some questions about the LGBT Pride Parade. Before asking the questions, let me explain that with the publication of the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, gender identity disorder was eliminated from the circle of mental illnesses and disorders. This means that this manual no longer recognizes these people as patients, and they are no longer medically labeled as having a mental disorder. These people are recognized as people without disorder, illness and disease, and everyone is obliged to have equal human relations with them. No person or organization has the right to ask about their gender, and no one has the right to mistreat them. The owners are obliged to rent houses to these people without asking about their gender and relationship. For example, if a woman applies for a house with her girlfriend, the owner does not have the right to reject them on the pretext of being trans. According to today's modern routine, rather than identifying these people as gay, lesbian, transsexual, or non-accepting of their identity, they are considered as normal people. Everyone is obliged to respect them as a normal human being, and their gender identity will not be an excuse for not giving them a job or paying them a lower salary. No one should look down on them. As long as they are busy with their lives and have a humane, moral, social and legal relationship with the people around them, no one has anything to do with their bedroom. In addition, no one has anything to do with their clothing, unless there is a specific dress code in certain places that everyone is obliged to follow. From a social point of view, even before DSM-5 took the action of removing sexual identity disorder from the circle of mental illnesses and disorders, people had gradually accepted these people, and their sexual boredom became less serious, and with scientific and legal approval, they were accepted like all humans with different tastes. Now the question that is raised, and the audience of which is LGBT people, is this: now that the law and psychological sciences have come to peace with your differences and are supporting you, and you are accepted as a normal person, like a straight person, why do you still hold a pride parade for a whole month a year? Do all the straight people still march for 1 month a year on the occasion of starting a family, having children, or having a beautiful life? Do they also constantly make animations, shows, dolls, etc. of their children and display them in the streets? Do they also hug each other all the time and walk as a family? Maybe they should really do something like this and show you this part of their life practically. If we are all human beings and we have achieved equal rights regardless of our gender identity and sexual orientation, then 1 month of Pride Parade every year should be held equally for everyone, otherwise it will lose its meaning, although a month of Pride Parade for life's axioms seems unreasonable. Do equal people need a month-long Pride Parade to show their differences in identity and sexual orientation? Don't they say that pride is not a virtue, and if we become proud, we will fall? So, what was the purpose of the acceptance of this stratum next to the normal stratum of society? An acceptable person, regardless of orientation and identity, does not need to show pride in the long term, 1 month every year. When you are considered psychologically healthy and socially entitled, why are your movements still increasing nearly a decade after the DSM-5 revision? Where does the budget and cost of such events come from? Before DSM-5, your movements and parades to achieve your desires may have been reasonable and justified, but what about now? Now that you have scientific, legal and social support, isn't it time to move on to your peaceful and happy life? When people reach the stability of their identity and instincts, they can now move on to progress in other aspects of their life. After being accepted, you continue to march and participate in rainbow movements. What could this mean? Are you still seeking to accept yourself and prove yourself to yourself or others? Are you constantly renewing your covenant with yourself? Are you still stuck in your acceptance? Or are you looking to promote and advertise your personal taste to others? Are you progressing in the same way in other aspects of your life? Are you constantly involved in sexual issues while going to work, raising children, cooking food? In the Pride Parade, you hold dolls made of male and female genitals and walk in front of people, including children. What exactly do these movements mean? You even sometimes expose your private parts. This is despite the fact that according to the teachings of global education, children are still taught from childhood that this part is your private part. If you go somewhere, don't let anyone touch these parts. Don't they teach this to children? Don't they teach children to cover their private parts from others and not appear naked in front of others? Global education teaches children that the part of body covered by bathing suit is their private area and strangers are not allowed to look at it. Despite these trainings and the emphasis on the need to cover the body and take care of the private area in front of others, how can it be justified to show these parts in the Pride Parade or carry sex dolls in these marches? Do you have another movement ahead so that exhibitionism is considered normal? Maybe in the next edition of DSM, we are going to see that exhibitionism will also be removed from the circle of mental disorders. Why do they categorize movies that show sex with the 18+ label? Why children aren't allowed to watch these movies? Why don't we allow children to watch porn? Aren't these contradictions? Doesn't your behavior in the Pride Parade lead to the normalization of nakedness and such issues for children? If we continue like this, won't we reach a point where we can play and watch a porn movie during family gatherings? How about we watch porn movies with family members just like as we watch an original movie and a literary and artistic masterpiece for entertainment and education? Where are we going? Indeed, what is the next goal of intellectual and not so original modernity?
It is really an interesting question. What is this Pride Parade for? Why does it continue? It made me think. What about you?
Double problem. Double problem. This category of gender transition due to the adjustment of identity, and again the change of orientation to same sex in the current situation, is a bit more complicated. Suppose that a girl, following the need for a boyish identity, transforms herself into a person with a boyish appearance through highly traumatic operations, and then following a sexual orientation towards boys, finds a male sexual partner. Now suppose that this same girl did not undergo surgery and found a male sexual partner. In this case, the marriage and the normal relationship of creation would be formed and the ability of the girl to have children would also remain intact. I think to myself, this girl is getting married to a boy without having a girl's name, without becoming a bride. It is as if a girl who became a trans boy eventually marries another boy without getting pregnant from that boy or without being able to impregnate that boy, a person whose identity is a trans identity who has become a man, and whose orientation is gay. Yes, things get a little complicated when both identity and orientation are reversed. Like a negative times a negative is a positive in math to negatives make a positive, it is only going against the flow 2 times. What a complicated and painful struggle. Also in the case of MTF surgery, imagine that after finding a feminine appearance, and after the surgery, the man becomes attracted to women, lesbians. Again, we have a boy who has become a girl and marries a girl who is not capable of impregnating her. With doing things the hard way, I feel deeply hopeless and empty. If there was no identity issue, would the orientation be in line with the biology and nature of this person? And if the identity problem allowed, without difficult surgeries, they would be placed in the other 2 spectrums of the rainbow, i.e. lesbian or gay. Now there are cases where both have undergone surgery, and now the lady and the man have changed their places and these 2 are getting married, only with a mutilated body and no pregnancy and fertility. Happy that the girl is in the place of the boy and the boy is in the place of the girl, and happy to have an identity with imperfect sex and being barren. I really get dizzy from seeing these examples. It is more like a game or a joke, and by the way, there was a documentary called Nature's Humor, made in Persian language. Do I have the right to sometimes think that because of the economic interests of the wealthy, or because of the genocide of some people with Nazi-like goals, there are predetermined programs in order to deceive young, sensitive, imaginative and at the same time intelligent people with the massive media and movie hype, and simply by finding commonalities with these designed concepts? Dr. Charlotte Tayar. November 20, 2019.
She is the right person to answer my intellectual concerns. Her answers and advices on issues such as beauty were so well considered that it made me think that we should spread these things as much as possible and make them available to everyone. In my opinion, it's good that fellow countrymen and other people of the world be aware of these global issues and problems. Dr. Tayar is a very good person to address these issues because she thinks very deeply about these issues and she has a special opinion in all areas. I'm a seeker and doctor's thoughts and experiences are informative. So I invited her to share her thoughts and experiences on this YouTube channel. She humbly accepted my invitation and gave me the honor to be with her as a manager and presenter. We are with you. Be with us and share your opinions with us. With awareness, we take stronger steps in life. With awareness, we make a better world. With awareness, we create a more beautiful world. Be your best self. Be your most beautiful self. See you.